Good morning. The rapidly expanding segment of society that I represent suffers from a horrific and painful disease of the spinal cord that is mostly iatrogenic. It's called adhesive arachnoiditis. Now please ask yourselves, have you ever heard of it? And let's be honest, because despite the multitude that contract the disease every year, this mysterious condition remains elusive to many in the medical community. Even some here today who are proposing new limitations and regulations on long-term opiate therapy for non-cancerous pain have bravely admitted their ignorance on the topic to various members of this and other patient advocacy groups. Adhesive arachnoiditis is a severe inflammatory response to a subdural insult by either chemical, surgical, microbial, or trauma, causing the internal nerve structures to permanently swell and adhere onto the inner wall of the spinal cord, the arachnoid, as it progressively restricts the CSF flow. The resulting injury is permanent, producing progressive neuropathic pain at levels beyond your imaginative comprehension. It is often described as the pain of terminal cancer without the release and comfort of death. Sadly, arachnoiditis is grossly misdiagnosed for various reasons, including the fear of reprisal. Sufferers must often endure humiliating circumstances as they fight for an honest diagnosis and lifelong treatments. Most, if not all, lose everything they've ever worked for: their livelihoods, their spouses and friends, their dreams, but mostly their sense of self-respect, as they are deliberately misinformed and unfortunately tagged with other trash can diagnoses when desperately seeking relief from their relentless agony. Over time, they are often rejected, considered expendable casualties and collateral taboo by the same medical industry that created them. Now, depending on the level and progression of the disease, symptoms can span a wide gamut from severe sensory disturbance, chronic intractable neuropathic pain, to permanent paralysis, along with other severe physical disorders and disabilities too appalling to describe here. We honestly believe that this horrible and shamefully misdiagnosed malady, one that is neither cancerous nor non-cancerous in our opinion, is unique and cannot be pigeonholed into either of the two categories proposed in PROP's petition, which is currently under review by the distinguished members of the committee. Therefore, we wish to propose that a third category be created for these incurable, non-cancerous conditions, one that would first recognize the severity of the modality, and then exempt sufferers from any restrictive policies that would limit their access to opiate consumption, since there are no other treatments. In fact, spinal stimulators have proven to be ineffective over the long term. Intrathecal pumps, surgical repairs, and other popular invasive therapies, such as Epidural Steroid injections, which are, by the way, not indicated or approved by the FDA, nor recommended by the manufacturers due to reports of severe adverse events, including the development of arachnoiditis, have also proven to be disastrous by furthering the progression of the disease. Dr. Antonio Aldretti of the Department of Anesthesiology at the University of Alabama, Birmingham, and director of the Arachnoiditis Foundation, was recently quoted by ABC News that as many as 10 to 15% of all epidural steroid injections result in a dura puncture. This error is specifically contraindicated by the FDA, grossly underreported, and the number one primary suspect as a cause for the disease, according to your own agency. These patients will no doubt develop chemical meningitis, which precedes arachnoiditis, requiring opiates for the remainder of their lives. Therefore, it is crystal clear to us why opiate prescriptions have nearly tripled since 1991. The explosive growth and invasive procedures by an exploiting medical industry to treat back pain is well documented. According to Dr. Martin McCary of Johns Hopkins, in his best-selling book, Unaccountable, over 30% of all medical procedures and surgeries nationwide are completely unnecessary. Additionally, Nearly 64% of all epidural steroid injections, a known cause of neurological damage such as arachnoiditis, are also unnecessary, exposing patients to needless risks, according to Dr. Lexmaya Manchakanti, Director of the American Society of Interventional Pain Physicians. With 9.5 million steroid epidurals given last year, that's millions of people, yes people, that were needlessly exposed to serious harm and the potential need for lifelong opiate use. You must admit that the graphical correlation is quite interesting and requires further analysis. Recently, our patient community was made aware by the CDC that 57% of fungal meningitis patients that received tainted epidural steroid injection therapy to treat their back pain have now contracted arachnoiditis. And yet we have been alerted by some of the very same patients and their families that they are now being coerced against their will to have additional injections before they would qualify for opiate medications to treat their condition. This is simply unacceptable and wrong. It should not be tolerated, but investigated. In closing, we wish to thank the FDA for allowing us to present our perspective on this extremely complex issue. We understand and sympathize with those who have lost family and friends as a result of their horrible addiction. No one wishes to be an addict, and we appreciate your efforts to first identify and then limit opiate exposure to disqualified candidates. However, please keep in mind that the need for opiate consumption is not always by choice or addiction. Thank you.